we see many people with back pain, and most of these people are really active. They lift weights, they play sports, and overall, they're really strong. In many cases, their backs themselves are also really strong. When we look at some of the research regarding patients who go to see their doctors or physical therapists for chronic back pain, many times their backs are actually stronger than people who do not have that history. But the difference is that the loading capacity of what their back can handle is decreased compared to those who don't have pain. So one of the things that we need to work on in physical therapy when we work with our patients, in addition to many other things, is increasing the loading capacity of what the low back, what the spine can handle. So we direct many drills to simply increase that stress tolerance that the spine, that the tissue surrounding have, so that this way they're not sending those pain signals and getting irritated as early as it would be for somebody who maybe doesn't. So here's an example of a few drills that I've done actually with one of my patients recently. It's demonstrated by my colleague, Dr. Liz. The first here is a 45-degree hip extension in this position. Liz is getting into a position where she's hinged over the machine here, so you can feel her low back in that area working a little bit. Shouldn't be all her low back. She should feel a lot of glutes, a lot of hamstrings holding her up. Hopefully some abs are involved in the front. But either way, the back still has to be involved to learn to handle that sort of hinge-like or horizontal position that can be so challenging to some people when they go to lift weights or anything where they have to pick something up off the ground, whatever the case may be. Now we also have a safety bar march where now we're getting the spine used to what's called axial loading of an implement through the body this way. So for many athletes, they want to be able to exercise and work out, and that involves maybe holding a barbell on their back or something like that. This hopefully builds that tolerance to it. And in this drill, Liz has our safety bar that she's holding over her shoulders, and she's doing a marching drill. It's not only teaching her to handle the axial loading or loading of gravity pushing down on her, but also how to shift her weight during it. So even if you're not necessarily an athlete or somebody who cares about doing these types of exercises in the gym where the weight is pushing down on you, it still is increasing the amount of gravity that's pushing down. So then for those people who have some back pain when they are standing for long periods of time, it's almost training it to be able to handle even more than maybe it may experience when you're standing around all day, to give you that room for error, so then it's able to handle what that day-to-day may throw at you. One complaint I heard from a patient recently is that they were standing at a concert all day and eventually the back got achy towards the end. So this is one of the drills we eventually built up towards so that he could be able to handle situations like that, because if he can do a drill like this with an appreciable amount of weight, something like a concert or similar shouldn't be as big of an issue. Now, finally, we have a half kneeling sort of rotational press. Liz here is using a physio ball that she's pressing into the wall to engage some lateral abs, those sorts of things, to then build that loading tolerance in a different plane, more of a rotational plane in this case, because life isn't always played straight ahead. Oftentimes we're turning, we're rotating in sport. We have to, maybe we're sitting in the car, we have to turn awkwardly to somebody talking to us in the seat behind us, any sort of things like that. So if you're somebody who has a history of back pain, you've maybe rehabbed it and worked on it in the gym and tried all sorts of things, but it's still not quite to where you want it to be. You stand for long periods of time and it starts aching. Maybe when you increase your workout regimen, it starts bothering you a little bit, or it just seems really irritable. There's likely a chance that its loading tolerance is not where it needs to be, despite the fact that you may actually be really strong. So if that's something that sounds like you, contact us. We would love to be able to help you with drills similar to this and many other tools that we have up our sleeve.